All right, what's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor, and here to break down health in a simple way. Now, we have all heard about artificial intelligence coming into healthcare, right? But what does that actually mean? What does that mean for patients? What does that mean for doctors and nurses? What does it mean for the hospital systems we work in? And here to explain that for us is Dr. Severence MacLaughlin, the CEO and founder of DeLorean AI. Severance, welcome.
Qasim, great to be here. I feel like I'm on Foursquare as a Kidney Week.
Oh,
with a celebrity. Yeah.
I don't know about celebrity, sir. I'm not a Kardashian.
Oh,
all right?
okay.
So, okay.
You're working on it, right? Yeah.
Okay.
But thank you very much for having me. We're looking forward to it.
Absolutely. So let's just get into it, man.
Okay.
I think there's a lot of questions out there amongst the clinical doctor nurses community. What is artificial intelligence?
Yeah, I mean, the definition of artificial intelligence, or what is it, is an important topic right now, and specifically within the healthcare industry. So AI, or artificial intelligence, the term has been bastardized, right? So anybody that's been using analytics is calling what they have AI, and that's doing a disservice in the industry. So what we define AI is the ability to predict something that happens in the future, and then with a probability, and then a next best action. Like, how do you change that reality in the future? And then the ability to learn, right?
Yeah.
So the machine learns.
So let's get into the verbiage then.
Yeah.
What is machine learning?
Yeah.
What is deep learning? What is that?
So if you take AI as a whole, machine learning is probably one of the smaller parts of the tool set.
Okay.
So it's a data science tool set. It's been around since the 1950s. You may have heard of a scientist called Turing.
Okay.
He cracked the code on the Nazi code machines, and he started this area of computer science or whatnot back in about 1954.
Okay.
So it's been around, but the reason it hasn't been able to be used is it didn't have the vast volume of data that needed, and that started in the early 2000s.
Okay.
Now, deep learning is 2 or 3 levels away, where you have machine learning, and then you have neural nets, which is a whole bunch of nodes of machine learning, and now you're going into vast amounts of data.
And those neural nets are supposed to mimic a brain neural nets, right? That's why they call
them the neural interactions. And then it's even evolving even more. Now you have something called liquid nets.
Oh, wow.
That are retraining themselves in real time.
Wow. And how's about this? As far as artificial intelligence, there's different types, correct?
Yeah, I mean, so people say there's different types, right? It's a broad area. I think the hot topic right now is ChatGPT, or generative AI,
right? Yeah.
So, and that comes into a smaller subset, another tool called natural language processing, right?
Yeah.
And that's where the computer can understand human languages like English or text or voice or whatnot. But then there is natural language generation. So they take all of that information and with a question can actually produce an answer. But there's a lot of problems with that today, right?
Yeah.
It's only come about a year ago, and so there's not a whole lot of guardrails or curation of the data sets. Now in medicine, there is no GPT that's validated currently. Okay. There's only one large language library that is validated, and people don't talk about the library.
Okay.
And it's important because the library is the basis of how the generation of the language comes about.
Interesting. And that language library, is that just contemporary colloquial English, or can it be trained on healthcare related language as well?
So it depends on what your GPT is. So OpenAI has, there's been issues, is scouring the world and the internet for all the data, books, movies, Wikipedia to generate these answers. Now that brings up a whole lot of issues with copyright and hallucinations and the curation. But in terms of medicine, there's only one clear library that's being curated.
Okay.
And that comes with the validity and the ability and the accuracy.
Okay, one topic I'm generally curious about, what is a hallucination?
Hallucination is when the AI gives you, or produces, the ChatGPT, OpenAI, produces an answer that is untrue, right?
Okay.
So you ask about a vaccination and it gives you the wrong statistics or gives you the wrong information.
So I've actually heard of an instance where ChatGPT quoted a book reference, but the book never existed.
Yes, or they'll say there was an issue with a professor in New Jersey that it made up a fake story that was alleged crimes, right? That's,
wow.
So that's a hallucination.
So all right, so let's get into it. So how does artificial intelligence get implemented in healthcare, or kidney care in particular, because kidney care is my kind of thing, right?
So yeah, so we are the first. DeLorean AI is the first true AI to be actually implemented in kidney care. Our flagship is medical AI. So our AI is currently deployed in chronic kidney disease, end-stage renal disease, but also the comorbidities, diabetes, cardiovascular disease, mental health. It affects people taking their medications. And the model does 5 things. So number 1, it gives you a risk stratification in real time. Milliseconds later, it gives you a prediction. Will that patient get better?
Yeah.
Will they get worse? Will they go to the hospital? Will they have a diabetic event? And number 3 is, what's the next best action for you as a nephrologist or a care team or the patient to take to either stabilize or get better?
Interesting.
And then the last thing is finding people that chronic kidney disease that don't know they have it.
Okay.
So you know that 30 to 40% don't know they have the disease until they get to the nephrologist.
Yeah.
Right? So we'll be able to identify them in maybe 2 or 1 or 3A.
Okay. And so you help me identify as a nephrologist who has kidney disease,
Exactly.
get that referral early.
Yep.
What about the progression of kidney disease? That's something you could do as well? Or?
Yeah, so it's like we call it the chemical equation, how we design that AI.
Okay.
Is actually identifying the trigger point for transitioning from, let's say, diabetes or coronary heart disease or cardiovascular disease into chronic kidney disease.
Yeah.
Or stage 1 to 2, 3 to 4, 4 to 5 of chronic kidney disease.
Okay.
And what's the next best action to retard that progression?
And dialysis patients, how does it affect them exactly?
Yeah, well, I mean, this is apropos because we just went live with innovative renal care with our renal AI model. So our technology is now at 250 dialysis centers across the country, in the nephrology practices and in the hands of the nurses and doctors. So we are now predicting hospitalizations before they happen. We're predicting anemia issues before they happen, mistreatments, why are they missing the treatment, and what is the next best action to prevent them from going to the hospital or preventing them to have a dive in their anemia or whatnot. So
I mean, it seems like this is kind of assists the trend in value-based care.
Oh, absolutely. It's bending the curve, right?
Okay.
So, some dialysis is fee for service and it's going to value-based care.
Yeah.
Where it's going to go, the government doesn't want to run this. It's going to be at risk at some point.
Yeah.
So you had DaVita and Fresenius, who had a moat around them, right?
Yeah.
Then you had Somatis and you had Health Map and Monogram that came in and disrupted it. The AI, our renal AI, with innovative renal care is going to disrupt the disruptors.
Okay.
Because the action of the AI is at the point of care and they can drive that for risk.
Okay. Interesting. So with AI, I think the biggest fear with AI is that AI will replace the physician.
Yeah.
Will replace the clinician.
Yeah.
And I think that it hinders the adoption of it to some degree, correct? And so what reassurance can you give me as a nephrologist or as a doctor that it won't do that? Or how's about this? How will AI actually be implemented in care?
My job in our renal AI, at least the AI that we work with, is to support the nephrologist, the clinical manager, and the care team to make better decisions and give them better information to make better decisions. So no human can see 2 years worth of bloods or BPs or anything like that. The AI brings all that together and then gives options to the physician. It's always down to the physician to make the final call.
Yeah.
You guys went to 4 years med school and whatnot. But the beauty is we had the same fears when we were training clinic managers and nephrologists with innovative renal care. And once they saw the technology, they could dive in and actually see what it could do. And they could say, oh, Mrs. Jones, I knew she was off. My gut knew it was off. Yeah. But now they have the reasons for it with these predictions.
Yeah.
So it's the technology is just validating that gut or that intuition or that training.
So it's really meant to supplement medical decisions, right? Give doctors another tool. It's not to actually replace them and say, we're going to make a decision for the patient.
Let me give you an example.
Yeah.
You're flying from New York to London, on a 747.
Yeah.
Do you want to be on the plane that the pilot is only flying, the computer is only flying, or both? I know I want a fail-safe. I want to be on the plane that has both. And that's how I see it.
That's an excellent example. So we're going to clear up right now.
Okay.
I got one final question that I like to ask my guests. What is the future of kidney care?
So I'm in AI, so I'm going to say that AI is the answer. But, like you give a hammer to a nail. But, so I think there's two answers. There's tactically, right? Yeah. So utilizing AI in the clinics and in the practices to prevent hospitalizations and stabilize so people have a longer life, more hugs with their grandkids or whatnot. But strategically, long term, is moving down the value chain into chronic kidney disease in the practices, identifying them earlier, maybe in 2 or 3A, holding them for 5 or 20 years, and driving that longevity. And they'll probably, kidney disease will not be the reason for death. So
awesome. Well, Seb, I appreciate your time.
Hey,
today.
I love hearing.
Awesome to see you. I appreciate guys that are like you are out there helping out with it.
Well, hey,
AI,
we
man.
need you guys to be on the same side. So thank you so much.
Right, thank you.